everyone in India, and a good morning, good afternoon to those who have joined us from around the world. I'm Saviera Barreto, and I lead industry relations at CitiusTech. We are a specialist provider of digital engineering, analytics, and consulting solutions to more than 130 healthcare and life sciences organizations across the world. Over 7,000 of our engineers and consultants help organizations use technology to reimagine the way healthcare is delivered to millions of patients worldwide. We're the largest pure-play healthcare tech company in India and also became India's 25th unicorn in 2019. Our speakers today are industry leaders from different parts of healthcare technology space with experiences spanning healthcare industries across the world. Our first speaker, John Squeo, is an industry veteran who has spent the most part of his last 30 years working closely with healthcare organizations, as well as technology leaders like CitiusTech and Accenture. He's joined us today from his home in Illinois, United States, to talk about how digital technology is altering healthcare industry dynamics and how one needs to prepare for a career in healthcare tech. Our next speaker, Kaustubh Chatterjee, is a highly regarded analyst and industry thought leader who covers evolving healthcare trends in India and globally. He leads NASSCOM Center of Excellence's digital health ecosystem, where he plays an active role in nurturing India's digital health network, driving policy advocacy, and catalyzing innovation across commercial and consumer health tech. Next, I would like to introduce Sridhar Turaga, a recognized industry visionary, a leading voice in digital healthcare, and a true advocate of transformation in all walks of life. Sridhar leads the Digital Technology and Analytics Services Group at CitiusTech, working closely with many of the world's largest and most sophisticated healthcare companies to transform healthcare delivery. And finally, I welcome Ravinder Singh, who is an innovator and thought leader who has spent a large part of his long career in strategic and global healthcare and life sciences organization. Ravinder is one of the most passionate individuals you will have come across when it comes to talking about healthcare. He joins us today to share his thoughts on how digital will shape healthcare in the near future. Kaustubh, Sridhar, Ravinder are all based out of Bangalore. Welcome speakers, and a big hello to our audiences. We have more than 1,000 attendees for today's session. With this, I will hand it over to John. Over to you, John.
Yeah, thank you very much. We're waiting for those to advance. So good afternoon, everyone, and around the world as well. Coming to you from Chicago, and I'm a little early here today. I wanted to talk to you a little bit about where we really are as an industry and how you might want to think about both opportunities in the technology segment and also why people are really going into healthcare in droves, particularly IT technologists. So really, this is your standard maturity curve of where organizations across different types of industry landscapes are really placed from an adoption of digital technology. And you can see that healthcare has been extremely conservative in their adoption. And of course, that does vary from country to country. I could tell you, even in the United States, if we took that just as a benchmark, we do have essentially the equivalent of an ERP, right, that holds the records, the EMR. But even those are very mature products, and they are, while they're deployed fairly ubiquitously relative to some other countries that don't really have those systems of record. This is a very legacy technology. So what's left? It's really what's left is what we're going to go into today. Is there's, even if you have an EMR in the organization, there's so much more that really needs to be done to interconnect the data, and so that really doctors and clinicians and allied health professionals and families can utilize that data. And then the second piece is there's so much more to do to create a great experience. So we're going to touch on that. But some of the things that have also driven the growth, in addition to just a recent recognition that we need to excel, is obviously the pandemic. That was a huge catalyst that kind of was really a sea change in how hospitals and medical professionals saw about technology adoption when they were forced, right, to not allow those patients to come into the office, and they had to connect over digital. Both the physicians, hospitals, and the patients, if they wanted to seek treatment, had to realize, they realized and they had to pursue digital methods to connect. That was everything you can imagine, from telemedicine, but also just basic communications and exchange of records. And that was just a huge boost. And now we're starting to take that catalyst and now stabilize it. And so there's all these real big catalysts to change that are happening right now. And the upside here is that we're really at the most nascent portion. So, if any of you are thinking about a career in this field, the sky's the limit, and the money and investment is there now to really utilize your talent. So real quick, I'm just going to pull on a couple threads here. When we think about that story, we're thinking about consumer expectations. Obviously, wouldn't, as a patient, you love to have something that works as well as, say, WhatsApp or Facebook, et cetera, to have experience that's truly seamless and integrated like that. And that is what chief marketing officers, chief patient experience officers, at least in North America, are all focusing on right now. And we're seeing big investment, which means for people in my field, it's super exciting time because we don't have to do EMRs anymore. We're doing things that really matter to people, and it's super exciting. And then, of course, we talked about the value-based, care delivery models. We talk about those all the time. All that means is that doctors are getting paid differently, and they're more adept to adopting digital technology and data exchange. So it's really driving that. Then we think about just medical devices on the bottom side. We think about how we're really having to utilize IoT. This has been taught for many years. There's been a lot of, pocket-sized types of investment, and now it's really coming in full force post-COVID. So massive investment, massive opportunities. And then we think of things like clinical decision support systems, which is really where we're starting to truly see the integration of AI into actual clinical workflows where doctors are adopting it and starting to utilizing it like it's one of their critical toolkits. So, the excitement is to build all of these technologies, and it's happening right now.
Thank you, John. First of all, thank you, CitiusTech, for giving me the opportunity to be part of this very important webinar. The topic is very relevant and the timing is absolutely perfect. Before I talk about the opportunity that exists in the health tech sector, let me take a step back and talk more about the company I represent, which is the NASSCOM Center of Excellence for IoT and AI. This team or this company was announced by the Honorable Prime Minister, Mr. Narendra Modi, in July 2015 as part of the Digital India Initiative. And the objective is to jumpstart the IoT and AI ecosystem in the country and really attain a leadership position in the convergent areas between hardware and software for various industries, including healthcare. The key objective of the center that I'm part of, which is the Bangalore office, is to create innovative applications and domain capability by truly harnessing the power of collaboration between local startups that are building solutions in India, and mature global MNCs like CitiusTech. So we are really at the intersection between local innovation and global scale, and we are enabling a lot of acceleration and incubation of progressive technology capabilities in the healthcare domain. This year alone, till 31st May 2022, we have supported 271 startup enrollments and prototype developments from our 4 different offices. Bangalore remains the global hub, but apart from the Bangalore office, we have 3 more offices, one in Gandhinagar, Gujarat, another one in Gurgaon, Haryana, and the third one is in Vizag, Andhra Pradesh. So all in all, Center of Excellence IoT and AI is sort of a private-public partnership between NASSCOM and Ministry of Electronics and IT and 4 state governments. They sponsor our initiatives, and we sort of try to collaborate with different players at the ecosystem level with the single objective to enable innovation locally for the global market. So it's widely reported that enterprise-grade digital transformation is a top strategic priority of all C-level executives across the healthcare sector globally today. But let's try to validate that hypothesis with statistics around how prevalent digital transformation is in the healthcare sector. So according to this Deloitte report, 60% of global healthcare leaders have already devised a very well-defined digital transformation strategy around their core incumbent clinical, financial, and operational workflows. 28% of them have already attained the first phase goal of digital transformation, and another 20% will attain that goal in the next 2 to 3 years. More importantly, 60% of healthcare leaders are also currently at the midway to their ideal digital state. And as you can imagine, these are very promising numbers as they go on to validate that A, first, digital transformation is already in full swing, and B, for most of these leaders, there is no going back from where they are now in the digital transformation journey. So just to put things into perspective, people, students, academicians who are trying to create a career out of health tech, I think you can truly expect a rewarding and recession-proof career ahead in health tech. I can testify that. So speaking about careers in health tech, we must also understand the healthcare technology ecosystem, right? What's the global revenue of the ecosystem? How is that going to change over the next 5 to 10 years? What are the different categories of digital health technologies one can expect to specialize in, to be employable in future? And of course, who will offer jobs? So this slide that I created basically is aimed at addressing all those questions. So first, take the first question. What is the global revenue of this ecosystem, right? So in 2022, according to global reports, the projection is this year alone that global digital health sector will contribute $110 billion of revenue. And this is revenue, by the way. When we talk about unicorns, unicorns are basically made based on valuation, but I'm talking about hard revenue. Any sector that generates more than $100 billion of revenue, it's considered to be a very, very promising sector and a great place to be from career standpoint. And then in the next 8 years, what is even more promising is this sector is expected to contribute 100% more in revenue and reach $250 billion by 2030. As a thumb rule, I think people will agree with me that any sector that generates double-digit CAGR year after year consistently over more than 5 years, it's supposed to be a sector for a very fulfilling and rewarding career. So health tech definitely is a shining example of the same. So I truly endorse and advocate that anyone who is aspiring to build a career in health tech, this is the place to be, this is the time to be. Second question was, what are the different technologies out there within the health tech sector? How can I prioritize my career goals? From that question standpoint, I think there are 3 types of health tech solutions that you may want to consider when you're acquiring skills, as you are studying, as you are getting training or getting certifications done, etc. So for engineering students out there, most of the career opportunities are in consumer tech. And these are basically technologies that are contributing up to 60% of the global revenue. So obviously, this is a very mature segment within digital health. There's a lot of traction to be made. There are a lot of unicorns out there building solutions, to basically capture the best potential that digital health has to offer. So engineering graduates are more prone, more relevant for this sector because once you're part of that technology, you'll be building that technology. You will work as a software engineer, you will build technologies. Those technologies will be then integrated into a front-end business-centric technology platform, and patients, consumers, their family members will use it directly. So this is a place to be for engineering students. For postgraduates, both engineering postgraduates and business majors, I think enterprise tech is going to be a very relevant sector because it involves strategic planning, forecasting, negotiation, M&A advisory, consulting, etc. So if you're planning to build a career, for example, in healthcare information exchange, which is a platform that enables safe and secure patient data transfer from different health systems at an ecosystem level at scale, you need to have both the engineering mindset and skill set, but also at the same time, you need to have a very consulting approach as to understand how those players will be interacting with each other, how that data will be ultimately used to enable better clinical, financial, and operational decision making. And finally, the other sector, which is roughly contributing around 10% of the digital health market, is research tech. But in terms of growth, that is the highest growth sector. And that's where you need specific clinical expertise. So this is where you will apply your medical insights, research credentials into technological workflows, and you will create infrastructure that will support and accelerate integrated clinical decision making. So anyone with a medical license, an advanced medical degree, a PhD can aim for this sector where you will be working directly in genomics, precision medicine, precision diagnostic, etc. And finally, at the bottom, I have the focus group. These are the people who will offer you jobs, right? But if you're part of CitiusTech, for example, you can access the best of all of them because CitiusTech, as far as I'm concerned, is working with all of them. And as part of CitiusTech, if you work with CitiusTech, you can access all of them at one go, and that too at a global level. So with that note, I'd like to hand over the discussion to the next panel member.
Thank you, Kaustav. Thank you for that context. I'll build on what John showed about the curve, if you remember. And the curve showed that out of 10 industries, the digital adoption in healthcare is at the bottom. But if you also notice, the curve was very steep. So as an engineer or an analyst or a data engineer wanting to think about healthcare as a career, a simple way to think about it is imagine that your bank recently started providing net banking, or you just recently started ordering food online, or digital payment just started, and look back at how quickly our lifestyle changed. In some ways, partly because of many structural challenges that exist, and partly because of what became possible after the pandemic. In some ways, healthcare is at that point where healthcare and life sciences is going to go through that dramatic change in the next 7 to 10 years. So that's the way I would visualize that. I've worked across different industries, worked with engineers and product teams across industries, and I've often found that typically a technology person is very attached to technology and they're neutral to which industry they work in. But in healthcare, I found it a little surprising that people, once they pursue a career in healthcare, doesn't matter what you are. You're a quality analyst, you're a designer, you're a mobile expert, you're a Java full stack developer, or a data analyst, or an AI engineer. Usually people like to stay forever. And I always wondered why that is. And one of the reasons, I think, is because the problems you solve are very purposeful. They're very impactful. So I thought I'll give you 2 examples of real life problems that technology is solving in healthcare and all our lives. And hopefully you will see that these are the kind of things that you can do if you explore this industry. All of us probably have at least one personal story of somebody in our family who was treated or diagnosed effectively or cured with the use of a CT scan in that care journey, in the diagnostic process. So we would always experience that. The magic of what is called medical imaging has dramatically changed early detection of many diseases and more precise diagnosis, even in not just in treating a patient, but every step of the care journey, including, for example, before a surgery. You cannot imagine now a surgery being conducted without a CT scan these days. The flip side of the story is that you can have all the technology in the world, but one of the bottleneck that we experience is radiologists who interpret these are limited, because at the end of the day, it needs that expertise to interpret and make recommendations. Just in terms of numbers, in a country like India, for every 1.5 lakh people, there's just one radiologist available. And I'm not even talking about how qualified they are for the range of questions they need to help with. Now, I'll take this further and look at it at a global level. You think about remote locations, this becomes really, really challenging. And as we all know, medical imaging is critical for early detection. For example, the death rate because of cervical cancer has significantly reduced, or mammograms have significantly reduced deaths because of early detection. Now, but the problem is that a typical radiologist is hard to find, not easily accessible, in spite of all the technology, and they're overburdened with number of cases they have to evaluate. For example, 100 plus scans in a day is not uncommon. So there are errors, inconsistencies to deal with. This is an engineering challenge. This is not just a medical challenge, but it's an engineering challenge. It's not just an operations challenge, it's an engineering challenge. Only through engineering analytics, you can solve this problem. For example, you're dealing with very high resolution images. So you may propose that, hey, why can't you do this remotely? When everybody is able to do things remotely, you're talking about, typical images that you encounter. You're talking about, multifold of that in terms of size. So that throws the first engineering challenge. We're all used to looking at, on a desktop or an iPad or even a mobile. That brings the second challenge. How do you render these without sacrificing the, accuracy of the information behind that? And more importantly, if you go to other areas like digital pathology, it gets even more complex than what we are normally used to seeing. So if you look at these challenges, there is a lot of opportunity to use the technology, but the technology can truly be deployed and scaled only if you can solve the next generation of engineering challenges. And that's what we are helping customers with. For example, how do you use AI or analytics to point out and kind of direct the radiologist towards where they need to look at and dig deeper? Or for example, how do you make it interoperable so that you can exchange this information easily or maybe remotely access, from a browser without all the physical infrastructure that you expect sometimes. So now you look at the technologies behind this, you're talking about cloud engineering. You're talking about, quality analysts who don't just validate the workflow, but validate the clinical accuracy or can validate the algorithms. You're talking about whole range of technologies, but applied to a challenge of rendering images much more than what most of these technologies are used to. You're also talking about a highly regulated environment, which means the changes that you make can't be deployed immediately, but need to be vetted, tested, and validated, and even get regulatory approval before those changes are made. So just now think of this as every technology challenge that you can think of in a typical consumer application, in a bank or in a telecom company, now significantly multiplied in terms of complexity. Last comment I will make is that it's not just about the complexity and the challenge, but this is also about human lives. The opportunity, the tolerance for error is very, very low. If you build a marketing application, you got it slightly wrong, what do you lose? You just sent a couple of emails out unnecessarily. But in the world of healthcare, as a patient, when you walk into a hospital, you expect that level of trust and accuracy in the system that you're walking into. So that's the context in which you could be a full stack developer, a mobile developer, a data engineer, a cloud engineer, or a quality analyst, or a data analyst, or an AI engineer. It's in that context. And this is one example. One more example very quickly, chronic conditions. All of us know that diseases like diabetes or any kidney disease or even obesity in some ways last many, many years. Not only do they last many, many years, but if they progress from a early stage to a more intense form, you have many other connected conditions. A recent example was COVID. There are a lot of people who got COVID recovered very easily, but if you had a prior condition of diabetes, then it became a life-threatening disease in some ways. Now, if these chronic diseases you live with over 20, 30 years, and typically it is expected that you visit a clinic or you need to get these regular checkups done or get access to care only in a hospital facility. Sometimes people cannot afford it. Sometimes it is not practical. It poses a lot of burden and people slip. They don't necessarily maintain and monitor their condition proactively. And it's been proven that if you're able to continuously monitor and adhere to a defined lifestyle, you can actually control the progression of the disease. And we're talking about 20 years, 30 years of monitoring. And this is where the remote monitoring technologies, what we call as Internet of Medical Things, becomes really, really important. The end consumer apps, connecting wearables, being able to provide that proactive monitoring and alert both the patient and the doctor become very important. So now you can see that in this kind of an opportunity, you'll see a whole bunch of new possibilities that technology can allow us. For example, any of you interested in real-time systems, in IoT, in remote monitoring, mobility, again, cloud technologies, analytics become really, really powerful in making this particular, range of solutions possible. Again, these are all things that are not just about better care, but making care more accessible. It's not just about a better solution, but a lot of rural locations, low-income countries, as well as a whole bunch of patients who can't access care easily for their constraints can now be provided higher quality care through the power of technology. We ourselves saw in India 2 billion plus vaccines rolled out in a very short amount of time. It could not have been possible if not of if not for the mobile technology and the tracking that we saw. No country could surpass that level of vaccination in such a short time. So these are the kind of possibilities that you can apply your technology skills, but solve some truly fulfilling problems. Last comment I want to make, if you go to the next slide, is a whole range of companies that we are the partner behind: product companies, hospitals, insurance companies, life sciences companies, both in drug discovery, building medical devices, researching cure for some of the rare diseases that need to be helped with. All of these are powered by cloud technologies, data engineering, analytics, user interface design, quality assurance, skills that you may have, skills that you are developing, but applied into a context that is much more meaningful. I'll talk a little bit after Ravinder about some examples of people that have gone through this journey, but handing it over to Ravinder.
Thank you, Sridhar, and hi everyone. Before I jump into these slides and what I'm going to talk about, I'll just share my personal journey. I've actually been a part of healthcare life sciences for about last 25 years. I started in the technology space, and when I started touching healthcare, what fascinated me at that time was the sheer complexity that it brings to deploy the same set of technologies that are deployed in other industries. But the sheer complexity provided the kind of challenge that I wanted to work with. And as Sridhar, John summarized and Costa summarized on the whole digital health, where we are today, what I'm going to talk a little bit about is where this is going. Because when you think about your career, you're not looking at an industry which is poised for growth, which is poised for adoption, and is extremely transformative in its behavior the way it does today and what it will actually do in future. And it provides all of us a lot of opportunity, whether we come from a technology background or we aspire to be in consulting, or we actually aspire to be a part of any other form of technology-driven solution providing as far as healthcare is concerned. So if you look at that healthcare, where will this go? So the example that we have taken so far, I actually call it the 4 C's of healthcare transformation. And this is first and foremost, it'll connect. Now, connection as far as healthcare is concerned, when we look about healthcare, what comes to our mind is hospital and the providers. But if you look at the ecosystem of healthcare, it's a very vast healthcare ecosystem. There is patient, there are payers, there are drug development companies, there are healthcare regulators who become a part of it. Then you have the supply chain folks who actually kind of just make cold chain happen. It's an extremely wide ecosystem. The first part is all of this ecosystem will start connecting, and that will start connecting over data. It will start connecting in real time, and it will also start connecting physicians, and eventually start looking at exchanging data in a manner that this information is available to the person who needs to take an action, a person who needs to do a diagnosis, or possibly kind of even the patients themselves to be in control. So the first and the foremost is the ecosystem will get connected. So look at the opportunities it provides. The second is it will actually enable collaboration. Given this ecosystem, now even if you look at the simple collaboration that the physicians require. My brother himself is actually a neonatologist, and he just talks about on a daily basis how many phone calls he just makes to his colleagues just to validate the kind of diagnosis he has done and what action plan he has, because he's really dealing with very fragile babies, and the collaboration is something which is extremely important for a physician. Now look at how you extend it to how chronic diseases are changing. Have patients manage themselves, and then finally have caregivers. We all take care of our own family members, and collaborating with them. How can we actually make all of this collaboration happen so that the healthcare effectiveness is improved? And then finally, how do you do it at a public health level? Because healthcare is not just an individual subject. It's not just a subject of the physician. It's also a subject of national importance. And how do you make the public health happen? And how do you integrate wellness into it? And then third part of this is make it consumerized. How do you kind of bring it all together for a patient? Right? How do you bring it together as a consumer so that you actually are able to consume this healthcare when you really need it on the preferred channel? And this is where you think about telemedicine, you think about remote patient monitoring, and then also healthcare is a constantly moving because the amount of innovation and scientific discoveries that happen. We today hardly know 10% of our bodies. We hardly know, the 10% of the gene sequencing that we have. So there is a significant amount of data that feeds back into research, and that goes to bench, and from bench to bedside. Huge opportunity that we actually see to make sure that this becomes consumerized. And then finally, cost effective, right? It's not just the cost effectiveness of what you pay to the hospital, but how often you kind of need healthcare. Can you prevent it? Can you actually look at new therapies which can not just prevent a particular disease from happening? Because look at chronic disease, it's a lifelong cost. Are there ways of intervening into it? So all of those are kind of opportunities where you are thinking about whether a connected ecosystem collaborates, makes it kind of around the patient, and then finally you kind of pay less for it. And that's where I would say the healthcare of the future is about. And this provides a significant amount of opportunities as far as the technology integration is concerned for all of us. So if we summarize all of these, right, I'll actually summarize these into 4 transformational themes that the whole healthcare ecosystem will go through. First and the foremost, the whole healthcare will shift the care to homes and community. And that means we will be kind of taking care of ourselves more and more rather than going to the physician for help, right? And this is where you need to reduce the chronic disease burden. So if you really look at the cost of the healthcare, whether it is in India, whether it is abroad, whether it is in developing countries, everywhere the rising cost is because of chronic diseases. People are acquiring it earlier. People are living longer. So the whole health span that a person has, where you don't need care versus when you need care, is extremely high. And we are anyway growing from a population standpoint. So the whole demand is how can you actually push it from a centralized healthcare provider to people taking care of themselves and reduce the number of people that are coming into hospitals. So this is changing the tiering of the whole healthcare itself. The second is completely reimagine, not redo, right? Just don't digitize. The idea is not to just take the same problem that we have and replicate it in the digital world, right? So what you do on paper, now you do on iPads. That's not the purpose. The purpose is to start looking at how do you reimagine the whole process of healthcare, right? How do you actually look at deploying these remote patient monitoring? How do you actually look at kind of, anytime, anywhere healthcare that you can actually have the best of folks, irrespective of where they are, actually be available for individual's care. And this is where the reimagination of the whole healthcare system comes. The third part of this is there is no way we can produce the level of expertise of a physician in a short period of time. There is absolutely no way to do that. The thoroughness that you need and also the practice that you need is a process. And there is, I think it'll be unfair if we actually push technology to them and they start kind of working with technology more rather than deploying their expertise on it. So the augmentation of the physicians, give them the right set of tools, give them, decision support so that, they can work, and give them the right data at the right time, because we are living in a data heavy world, right? That is something which will be extremely powerful for physicians. At the same time, it will actually reduce the burden. So we'll be able to kind of really scale the existing capabilities that we have. And this is where AI machine learning kind of technologies will come into picture. And then finally, how do you build this data strategy, right? Think about, whole of this ecosystem is generating data, whether it is a machine, whether it is a variable, whether you yourself are generating any data because you're searching on the internet, it's actually telling, something about what you're concerned about your healthcare. So there's a whole lot of data. How do you deploy? How do you harness it so that you give these insights? And these insights are either for public health, either these are for research, or these are for actually improving processes. The data becomes, the gold mine that each one of us will actually be looking for. So from that perspective, if you think about it, right, the technology integration will combine all of these. Mobility, right? Converge all of these technologies for consumption on mobility. Move all your workloads onto the cloud, right? Make sure there is light level of connectivity, that high speed, high thick, or high fidelity data like MRIs can be exchanged seamlessly. How do you start looking at data management? And then finally, think about digital twins. Can we actually not look at digital twins for either education or research purposes, or even remote diagnosis purposes, right? Without actually compromising the safety of the patients. So, and finally, AI, machine learning, semantics, because healthcare is extremely semantic oriented. So these are some of the technologies that will start converging in different manners to kind of have the next generation of processes, the next generation of how the healthcare system will start behaving. And that's the opportunity that we see. So look at how you can actually be a technologist, how you can actually bring in the expertise of any of these digital technologies to bring home the solutions. And then finally, also look at how you can actually transform the processes that are associated. And at the end of it, the biggest beneficiaries are us, because we are the consumers of what we actually build.